Uremia, also known as end-stage renal disease, is a condition characterized by the accumulation of toxins and metabolic waste products in the body due to decreased kidney function. This condition has profound effects on various organ systems, leading to a wide range of clinical manifestations. Understanding the complex pathophysiology of uremia is crucial for healthcare professionals involved in the management of patients with this condition. One of the key aspects of understanding uremia is comprehending the intricate mechanisms behind its development and progression. Uremia arises due to the progressive decline in renal function, leading to impaired excretion of metabolic waste products and electrolyte imbalances. Additionally, there is disruption in the regulation of fluid balance, acid-base homeostasis, and blood pressure control. The pathophysiology of uremia involves a complex interplay of inflammatory, oxidative stress, and neurohormonal mechanisms, further contributing to the systemic effects of this condition. Epidemiological studies play a vital role in identifying the prevalence, risk factors, and outcomes associated with uremia in specific populations. The incidence of uremia varies globally, with certain populations at higher risk, such as those with diabetes, hypertension, and genetic predispositions. By analyzing epidemiological data, healthcare providers can develop targeted prevention strategies and optimize the management of individuals at risk for developing uremia. Clinical manifestations of uremia are diverse and affect multiple organ systems. One of the most severe and potentially life-threatening complications of uremia is uremic encephalopathy, characterized by cognitive dysfunction, seizures, and altered mental status. Cardiovascular complications are also common, including hypertension, left ventricular hypertrophy, and increased risk of cardiovascular events. Hematological abnormalities, such as anemia and bleeding tendencies, are also frequently observed in patients with uremia. Understanding these manifestations is essential for early detection and appropriate management. Uremic toxins, including urea, creatinine, and indoxyl sulfate, play a crucial role in the pathogenesis of uremia and its systemic effects. These toxins accumulate as a result of impaired renal excretion and contribute to the development of inflammation, oxidative stress, and cellular dysfunction. The importance of understanding the role of uremic toxins lies in developing novel therapeutic strategies aimed at reducing their accumulation and mitigating their deleterious effects. Dialysis is a cornerstone in the management of uremia, providing a means to remove accumulated waste products and maintain fluid and electrolyte balance. Hemodialysis and peritoneal dialysis are the two main modalities used in clinical practice. Each has its advantages and limitations, and the choice of dialysis modality should be tailored to individual patient needs. Understanding the efficacy and complications associated with different dialysis modalities is crucial in optimizing patient outcomes. Uremic neuropathy encompasses a variety of peripheral and autonomic nervous system dysfunctions that occur as a complication of uremia. The precise mechanisms underlying uremic neuropathy are not entirely understood but likely involve a combination of metabolic derangements, vascular changes, and immune dysregulation. Clinical presentation can vary, including sensory disturbances, motor weakness, and autonomic dysfunction. Early recognition and targeted interventions are essential to prevent further deterioration and improve patient quality of life. Uremic cardiomyopathy represents a spectrum of cardiovascular abnormalities resulting from chronic kidney disease. The pathophysiology is multifactorial, involving hemodynamic alterations, electrolyte imbalances, oxidative stress, and inflammation. Left ventricular hypertrophy and heart failure are common manifestations in patients with uremia. Accurate diagnosis and management strategies tailored to the individual patient's needs are crucial to optimize cardiac health and reduce morbidity and mortality. Uremic pruritus, or persistent itching, is a distressing symptom frequently experienced by patients with uremia. The exact etiology of uremic pruritus is not completely known, but multiple contributing factors have been proposed, including accumulation of pruritogenic substances and alteration in the itch pathway. Managing uremic pruritus involves a multidisciplinary approach, targeting both the underlying cause and symptomatic relief, as it significantly impacts the patient's quality of life. Uremic coagulopathy is a complex phenomenon characterized by abnormalities in hemostasis and platelet dysfunction. The intricate mechanisms leading to coagulation disturbances in uremia involve both qualitative and quantitative abnormalities of coagulation factors, platelet dysfunction, and vascular damage. Understanding the clinical implications of uremic coagulopathy is essential for preventing thrombotic and bleeding complications, and guiding appropriate therapeutic interventions. Uremic bone disease, also referred to as renal osteodystrophy, encompasses a range of mineral and bone metabolism abnormalities that occur in patients with uremia. This condition predisposes individuals to skeletal complications, including bone pain, fractures, and osteoporosis. Disruptions in calcium and phosphate homeostasis, impaired vitamin D metabolism, and alterations in the parathyroid hormone axis are key contributors to the pathogenesis of uremic bone disease. Effective management strategies involve a comprehensive approach to address mineral imbalances and optimize bone health. Uremic gastrointestinal manifestations encompass a wide range of symptoms and complications, including anorexia, nausea, vomiting, and gastrointestinal bleeding. These symptoms contribute to poor nutritional status and reduced quality of life for individuals with uremia. Effective management involves controlling uremic toxins, optimizing dietary interventions, and addressing comorbidities that may contribute to gastrointestinal complications. Uremic myopathy is a debilitating condition characterized by muscle weakness, wasting, and decreased functional status. The exact pathophysiology of uremic myopathy is multifactorial, involving metabolic abnormalities, oxidative stress, and impaired protein synthesis. Early recognition and intervention, including nutritional support and physical rehabilitation, are critical for minimizing the impact of uremic myopathy on patient quality of life. In conclusion, understanding the complexity of uremia is important for healthcare professionals to improve diagnosis, management, and prevention. Ongoing research and medical advancements are key to improving patient outcomes and quality of life.